If you delayed taking Medicare at 65 because you wanted to continue to work, you were on your employer's health plan, it had 20 or more employees, you were like, I'm fine. I don't have to take Medicare. I don't have to start paying for Medicare Part B or Part D. You might have to rethink this now that the laws are changing for 2025. And this is potentially going to blow up for thousands, I hope not millions of people. So what happens is when you delay Medicare, your employer is telling you our insurance plan, yes, we have 20 or more employees, our insurance plan is as good or better than Medicare. Therefore, you can stay on it as long as you want, and your spouse can too, past 65, and you will not be subject to any late penalties. The problem with the new law for 2025 is they're capping Medicare Part D drug costs at $2,000. So if your employer's plan does not cap your out-of-pocket drug costs at a total of $2,000, it's not as good or better than Medicare. Meaning, you will be subject to a late Part D penalty eventually when you go off of it and do apply for Medicare Part D. Now, the penalty for Part D, it's bad. Any penalty is bad, but it's not as bad as a late Part B penalty. And that would be if your employer had under 20 lives or their plan wasn't as good or better than Medicare. So the Part D penalty, this year, let's say you were 1 year late and you tried to enroll this year, it's just an extra $4.20 a month. It's not terrible. If you're late for Part B, it's 10% for every year. And since the average cost this year is $175, that'd be $17.50 a month. So it's a lot bigger chunk of money for being 1 year late. Part D, $420, it's not great, but it's a lot smaller, which I think, people won't even think about this. Let's say you work from 65 and you don't retire until you're 75. More and more people are working longer, sometimes because they want to and they like their job. A lot of times because they have a younger spouse, sometimes even minor kids they're trying to keep on their group insurance plan. So you work till 75, that's 10 years, you're 10 years late. This penalty for Part D, because your insurance at work wasn't as good, you'll pay that penalty, and it kind of goes up because it's every year that you're late. So you were 10 years late, and they do it. It's 1% times the average national price. The average national price has been about $32 since 2005. We're expecting it to go up a lot this year. We have no idea what it's going to look like, if it's going to be $50 or $100. But when we're talking about 1% of $100, it's a lot worse than 1% of $32. So you're going to get the penalty, whatever it is, and you'll pay it for the rest of your life. It's a lifetime penalty. It does not go away. So we would love for you to be able to avoid it. What do? You go to your HR director, whoever handles the benefits in your company, and you say, they're supposed to give it to you in writing anyway, and they probably do, and you throw it away. But you want to have a face-to-face and say, hey, I need it in writing. Is our drug benefit as good or better than Medicare? And if it's not, you guys, all you employees need to lean on them to make it better. Otherwise, you got to enroll in Medicare Part D and pay for Medicare Part D. So everybody's going to have to fight this battle out with their own employer. If you need our help, our consultations are free. Go to our website, themedicarefamily.com. If we can help you, book your free appointment. Thanks. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.